Today we're diving into the world of postpartum doulas, who they are, what they do, and why they may be one of the most best kept secrets in maternal care. So let's imagine for a moment. You've just given birth. Your baby is maybe a few days old, or maybe even a week. You're running on very little sleep. Your body is recovering from whatever it may be. Your mind is adapting, and your emotions are a bit of a roller coaster. You're craving rest. You just want to eat something and a little time to feel human again. But this is where the magic of postpartum support steps in. A postpartum doula is someone who comes alongside you after birth, providing evidence-based care, emotional support, and practical help in the home. We're not medical, we're not clinical, but we are deeply supportive in a way that makes the transition into life with a new baby feel a little less overwhelming and a lot more doable. Love and blessings, beautiful people. My name is Elizabeth Vanderwalt. I'm a holistic doula and a women's health coach currently residing in Saskatchewan, Canada. Everything said in my videos are for educational purposes only. I'm not giving out medical advice as I'm not a doctor or a medical professional. Please do your own research and consult a healthcare professional if you so choose. I'm so excited to take a dive into today's topic because I am a postpartum doula and I want you to know all the reasons why I love this work. Let's jump in. What exactly is a postpartum doula? A postpartum doula is trained to support families in the very first few days, weeks, or even months after a baby arrives. Our role is not a one-size-fits-all, but rather it's built around what each family needs. Because we're all different, our family dynamics are different. This is very different from a birth doula because, as we know in a previous video I said, a birth doula supports you during labor, and some doulas do both, like myself, but postpartum care is a world of its own. So what does a postpartum doula actually do? Well, there are typically two types of support options, and I'm going to try to break them up later for you. But daytime support often comes in whatever hours that you fit best, but normally 4 to 6 hour shifts. Whereas overnight support is usually from the hours of 10 p.m. to 6 a.m. But I'm going to break down both for you, and I just want to dive into what the support could look like for both of those momentos. So let's look like what daytime support looks like. A daytime postpartum doula might help you do the following, and this is something I primarily do, is I help you learn infant care basics. So the diapering, the swaddling, the bathing, and the feeding cues. You're going to get support with feeding, whether it's breastfeeding, chest feeding, pumping, or formula. I'm also, and this is a huge thing I do, is I offer nourishment guidance or I prep simple meals. I love coming into a house and helping make things cozy for you by giving you some warm food. And I also love to tend to the baby's laundry or any light tidying you need around the house. Even if you have it washed, I'll fold and put it away, whatever helps. Provide emotional support and active listening. And this is a big one that has helped clients in the past, where I just come and listen to kind of what maybe is changing for you and you want to talk about. I also help you set up baby care stations that actually make sense for a daily routine. This kind of care is especially helpful if you're feeling unsure, or maybe you're underprepared, or you just want a calm and knowledgeable presence by your side. So how does overnight support work? Well, this is something I don't primarily do, but an overnight postpartum doula steps in while the family sleeps. So that way you get a full night's sleep, and what they'll do is they'll often care for baby between feeds. So they'll take care of burping, changing, rocking, and back to sleep. They will also prep or sterilize any bottles that might be needed. You'll also find that they'll manage pumped breast milk or formula safely. So if you are breastfeeding, they'll bring baby to you, or you'll have it pumped and they'll just worry about baby all night long. They'll also help keep baby upright after it feeds to reduce spit up or reflux. They also might do baby laundry, so you wake up to fresh folded clothes. They may start a crock pot meal, or they may prep some grab and go snacks for the next day. While at the same time, they're going to be creating a calm, a very quiet and nourishing energy throughout the home so that your rest is actually restful. And even if you're breastfeeding, like I said before, you can benefit from overnight support because the doula normally brings the baby to the parent for feeding. We can help with latch, and then they normally take baby back for burping and soothing. So that way this allows for you to return to sleep and have a better and smoother recovery. Because even after having a major surgery, you wouldn't expect someone to be up at many hours throughout the night. So now I want to talk about some of the other ways that a doula can support your transition. So what we like to call postpartum is the fourth trimester, and this is normally the 12 weeks after birth, but oftentimes it can refer to actually your entire year after you have a baby. This is often overlooked in traditional healthcare systems, and yet this is the time that is critical for the most bonding, healing, and rebalancing into the new world. Postpartum doulas normally fill in the gaps by doing some of the following. Our goal is to encourage you to rest and to recover as much as possible. We'll also help identify signs of any postpartum mood disorders. We can also support the partner or other children in the household. We are also great at providing referrals, so we know what lactation consultant to get, who you should be talking to for a pelvic floor therapist, and if you need mental health specialists in your area. Our main goal is to create easeful rhythms in your home through organization and planning, and just make sure that you're fully taken care of, because we work for you. So that is, if you need a nap, maybe you need a shower, or you need someone to say, "You're doing great," or "How's everything been going lately? Tell me the real truth." Our job is to hold space and offer you real-time and tangible help. Let's talk about tips for finding a postpartum doula. If you're ready to find support, here are a few of some steps that you can look into to getting that information. So first off, you're going to want to talk to your circle in your area. Reach out to any local parents that you might know, midwives, or holistic health providers that may know of someone, because our word of mouth is golden. You also could check on online directories. There are sites like Doula Match, or I'm trying to think of some of the other ones. Even if you just Google postpartum doula near me, you should find those in your area. Also, a huge goldmine that we as doulas try to look for, but as you as parents should look for, is look through Facebook parenting or doula groups. So there's one that's called like Find a Doula Near Me, and there are people out there in your area all the time. Now, another big part with it is setting up interviews. A postpartum doula is someone you're inviting into your home during a very sacred, a very sensitive time period, and you're gonna want to meet them ahead of time. You want to ask the questions, and you want to get a feel for how your personalities align. You really want to see the vibe that they're giving you, and if you guys really connect on like a friendship level. Another one, and this is up to preference again, is if you want to ask about their credentials. So certification isn't mandatory to be a doula, but sometimes it's really great just to know about where they took their training, what it was like. It's also great to ask if they've got CPR or first aid, which most doulas have as a standard practice. Some ask for a background check if you would like, or liability insurance. Those are all options that you can ask about and see if that's something you need. Another big one is to review a doula's contract. So every doula has a unique way of working. My agreement is definitely different than other doulas that I know, and I'm sure that there are many differences throughout the world. But the agreement should clearly outline some of the following things, like support, what are their hours and fees, and any guidelines for cancellations or rescheduling. And as parents, I always suggest to read your cancellation or rescheduling guide in the contract, just so that you know what you're getting into. Now, lastly but not leastly, I want to talk about a few extra considerations to have, and one of that is being budgeting. So doula care is very often, 9 out of 10 times, a out-of-pocket expense. Some health spending accounts or insurance plans in Canada and the US are beginning to reimburse for it, especially if lactation or mental health support is included, but most oftentimes it's by yourself. Do ask if there are doulas in your area offering sliding scale or low-income support. Another big one is to look for availability. If you really are considering a postpartum doula, the best time would probably be contact halfway through your pregnancy, because doulas can book up quickly, especially if it's overnight stuff. That's a very in-demand project right now. You also want to look in to see if there's an option about virtual support. So if you're in a remote area like myself, maybe there are not many doulas in your area, then you want to look to see what virtual postpartum support can be. And although it may not be like the helping with laundry or meals, it could be guiding you through baby care, breastfeeding, or emotional support, or even helping you organize your home setup via video call, which is normally prior to a baby being born. Caring for a new baby is profound, and it's also very exhausting. I feel for every single one of you that is dreading the upcoming or that is currently going through it. The idea that parents have to do it all alone isn't really realistic, and honestly isn't very natural. All over the world and in past centuries, countless cultures, it has always been that postpartum care has been support, with either mothers or grandmothers, aunties, and other sisters in your community that support you. It's always been communal, supported, and gentle. And that's where our jobs come in today, because a postpartum doula offers that missing village that we're lacking. And we just walk beside you so that we listen to you. We are trying to lift you up and remind you that you were never meant to figure it out all on your own. Thank you so much for watching another video. Please, please, please subscribe or like this video, and you can find more tips like these on my channel. I've got hundreds, or well, starting to be hundreds on my channel. So, peace.